Hi there. Has anybody talked to you? No? Okay. Alright, and you're here for a exam. Of course you are. Of course you are. I knew that. Okay, give me just a moment to check to see what we got going on. Oh, I see you now. There you are. I was just kidding. Alrighty, so you have agreed to partake in a exam as part of our student program, is that correct? Wonderful. Well, thank you so much for participating in that program. We so appreciate you trusting us to take care of you while we're learning how to do that. Of course. And are there any specific concerns that brought you in today? Okay. Alright, perfect. So we just want to do an overall checkup, but you want me to just check your ears too? Alright, that's no problem. I can definitely do that for you. I've done that a lot so far. Oh, lots. Perfect. Alright, let me just grab some basic information for you, okay? Alright, and then what is your first and last name? Okay, and then your last. Alright, and your date of birth. Perfect, thank you so much. And are there any medications that you have any known allergies to? No. Alright, perfect. Good. And are there any other concerns I should know about? No. Okay. Perfect. Thank you so much. Alrighty, so I'm gonna get started with your exam, if that's okay with you. Perfect. So the first thing I'm going to do is just to do a quick disinfectant of my hands with some hand sanitizer. Alright. So what I'm going to do first is, what am I doing first? What am I doing first? What am I doing first? Oh, I'm gonna put some gloves on. I'm gonna do that first. And then I'm also going to do a basic exam. Yes, a basic exam. I'm gonna take some, vitals. Some vitals, yes. And I'm also going to, do an eye exam, just to make sure all is well there. And then, what did you say? You wanted to your ears, right? And then we'll do an ear exam as well. Yeah, and sometimes if your ears are bothering you, it's connected to your throat, I think. So I'll maybe also just check on that too, if that's okay with you. Okay, good. No, yeah, absolutely. You're in great hands. You're in perfect hands, the best hands. All is well. Alright, I'm gonna get started with some gloves. I'm just gonna check these over and make sure there's no issues with the gloves. Do they look okay to you? I don't know. They do. Okay. Perfect. Alright. those vitals. Yes, the vitals. Okay. So, first, actually, I'm gonna check your eyes first, okay? Okay. Okay. Alright, so first I'm just gonna use my pen light to just check into your eyes, and then we'll do a basic eye exam, okay? Perfect. Alright, so how do I turn this thing on? I don't know. Oh, I figured it out. Alright, so I'm gonna check both of your eyes together, and then one at a time. Alrighty, so I'm just gonna check those eyes, make sure they look good. And gosh, that light's so bright. Alright, and on, okay, and on, perfect, okay. So now I'm gonna do one at a time, okay? Alright. Yeah, that's what they taught us to do, you know, little swirls to check your pupils. Alright, and the other side. Alright, perfect. So what I'm gonna have you do is follow the pen with my light if you can. Perfect. Okay, so we're gonna go side to side. Side to side, side to side, side to side. Alright, and then up and down and down and up and down and up and down and all around. Perfect. Okay. So next what I'm going to do is do a basic eye exam. Yes, we just want to make sure everything is looking perfect. Alright, so I'm going to have you read me off the very first letter, if you can. E, amazing. And then these. L, perfect. And T, wonderful. And this next letter is F, P, and H. Alright, and the next letters are this one, O, yep, and then L, C, F, wonderful. And we're gonna have you go down to this line. So that's, yep, D, H, J, B, and S. Amazing. Can you go do the next line down? You can. Wow, that's amazing. You have great vision. Alright, so where did we leave off? I don't remember. I'm gonna start here. So this row is E, yep. P, D, yeah, C, and O. Wonderful. And can you also do the last line for me? Alright, you ready? Perfect. Okay, so we've got L. Good. D, yep. F, P, yes, P, and H. Wonderful. Okay, so I think your eyes are good because you got to 2020, so yay. Good job. Okay. Okay, and, so next I'm just going to take some measurements of your face, okay? Because making sure everything's proportionate, you know, you never know what could be causing any ear issues. Yes. Alright, so again, just some basic measurements. Alrighty, so I'm just gonna go right above your eyes. Just see. Alright, to them. Okay, and I'm gonna do forehead, inspection in there, make sure everything looks okay. Just gonna switch hands. Alright. And we're looking good. Yeah. No obvious issues in there, but I mean, other than just, brush your teeth, obviously. Alright. Good. And I'm gonna have you stick your tongue out as far as you can for me. All the way. All the way. All the way. Perfect. Alright. Good job. And just gonna go inside and check. Alright. Oh, that looks pretty good. Good. Excellent job. Yeah, that looks pretty good. Alrighty, so now I'm going to just swap this out and do a quick ear check, okay? Of course. Alrighty. Perfect. Alright, just hold it as still as you can for me, okay? Yeah. Alright. Just check here. Ear for anything. Nothing concerning. Alright, let me check the other side. Alright, it's looking pretty good. Alright, and I didn't see anything obvious. But I'm just gonna do a quick Q-tip in there just to get any kind of gunk that's in my way, okay? Alright. Perfect. Now I'm just gonna take this Q-tip in, okay? Alright. Alright, and the other side. Alright. No pain. Perfect, alright. And let me just check again, okay? To see if I get a better picture now. Yeah. Alright, and the other side. Alright. I gotta say, your ears look pretty good. I don't see anything too obvious going on up there, if you know what I mean. No, I don't know what that means either, but you look good there. Okay. Next, I'm just gonna use some tools I have to just test your hearing, okay? If you can tell me whether you hear it from the left side or the right side, that would be great. Alright, ready? And, yep. Which side? Good, alright. Oh, I forgot to tell you to close your eyes. My bad. Can you close your eyes for me? Good, alright, ready? And, alright, which side? Which side? Which side? Perfect, alright, I'm gonna do it again. Are you ready? Keep your eyes closed. Okay. And alright, do you hear it? Good. Alright, and then I'm gonna do that again. Which side? Perfect. Alright, good job there. Now I'm gonna do that again, just with a more sensitive tool, okay? So it's a little bit harder to hear. Absolutely, okay. You hear that? Perfect. Okay, you ready? I'm gonna do it again. Hear it? just cross all our I's and dot our T's. I think you know what I mean. Alright, and your hand. I'm just gonna... Do you feel that? You do. Okay, good. One more time. Alright, and let me try your elbow too. Your elbow. You feel that? You do. Okay, let me try this side. You feel that too. Okay. How many? 3. Perfect. Okay, and then your elbow as well. 1. Good. And good job. Awesome. Yeah, I think you are seemingly a-okay, so that's really good. It's really good for you. Of course, so what I'm going to do next are take some vitals, okay? Yeah, I probably should have started with those. Oops. My bad. Alright, so first I'm just going to listen to your heart, okay? Alright, and if you can, do me a favor and just take a nice deep breath for me. And let it out. Good, I'm going to move it and deep breath in. And out. Good. Okay. And another deep breath in. And let that out. Alright, feels pretty good. A couple more times, okay. Deep breath in. And out. Okay, and one more time. Deep breath in. And out. Okay. Yeah, your breathing sounds pretty good. Yep, let's just check your blood pressure too, okay? Of course, I'm happy to help in any way I possibly can. Sure. Alrighty, perfect. And let me just grab these again. Alrighty. I'm just gonna do a quick pulse check on there for you. Okay. Alright. Just see. Alrighty, that looks pretty good. Just gonna release some of that air out a little bit. Perfect. I'm gonna slide it off and just do the other arm, okay? Yeah, just stay patient for me if you can. Alrighty, and I'm just going to alrighty, and do a quick okay. You can leave